Assalamu alaikum. Good afternoon. My name is Ravi Mamtani, and I work at Weill Cornell Medical College in Qatar at the Institute for Population Health. And I'd like to begin by welcoming you to our Population Health and Wellbeing series. And uh, and just a reminder that the objectives of the series are threefold. One, discuss contemporary and critical topics relevant to healthcare, medicine, and population health. Two, examine evidence-based practices germane to public health and patient care. And three, describe opportunities and challenges in evolving phase of healthcare. A couple of housekeeping notes as we move forward. Your cameras and microphones are turned off. Please use the Q&A feature to type questions and comments that you might have, and we will address the questions at the end of the session. A statement on accreditation. This activity is accredited by ACCME and also by DHP, Ministry of Public Health, Department of Health in Qatar. So, insofar as evaluation and certificates are concerned, the post-activity evaluation will be available in your Cloud CME by May the 22nd, 2025. Healthcare practitioners licensed in the state of Qatar will only receive their credits once the QID and MOPH license number is provided. You will receive an email notification once the evaluation is available in your Cloud CME account. And finally, your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So over to today's topic. And the topic is entitled The Role of Mind-Body Medicine in Complex Healthcare Systems. And to do that, we have a very distinguished physician from the US in Dr. Darshan Mehta. And I'll introduce Dr. Mehta in fact, I'll introduce him now, and then we'll go on to his remarks. So Dr. Mehta is a general internist and assistant professor in medicine and psychiatry at Harvard Medical School. He's the medical director of the Benson Henry Institute for Mind-Body Medicine at Mass General Hospital and Medical Education and Education Director for Osher Center for Integrative Health at Brigham and Women's Hospital and HMS, which is Harvard Medical School. Most recently, he was appointed as the co-director of the Center for Comprehensive Healing. Dr. Mehta received his MD degree from the University of Texas Southwestern Medical School, and then he went on to complete his residency in internal medicine at the University of Illinois in Chicago. And he completed a clinical research fellowship in complementary and integrative health at the Harvard Medical School Osher Research Center, and at which time he also earned his Master's of Public Health. He is board certified in integrative medicine and has done professional training in mindfulness-based stress reduction at the University um, um, of Mass General Center. He's on the board of directors for the Academic Consortium of Integrative Health and editorial board for the Journal of Integrative and Complementary Medicine and Global Advances in Integrative Health and Medicine. I could talk on Dr. Mehta. I've known him for a couple of years at length. But I think, needless to say, that he's well accomplished. He's a great guy. He's a great colleague. And we are grateful to him for having taken the time out of his busy schedule to be with us this afternoon. So, Dr. Darshan Mehta, thank you so much. And over to you.
Thank you. Thank you, Dr. Mamtani, and thank you for that kind introduction. It's really an honor to be with so many of you this afternoon. It's a morning here in Boston, but I'm so excited to be with you. So I'm going to turn over to my slides. Okay. So mind-body medicine in the modern healthcare system. Why does this matter? I think many of you who have been part of these series have heard all these various topics in that kind of come along lifestyle and integrative medicine. And if there's one area that I've been most passionate about amongst that whole really amazing growing field, it's really this area. And I hope to impart upon you by the end of this presentation why it's important, what the implications are for our future, and how we can actually just start thinking about it both at the individual level, but in sort of in alignment with the mission of the work that Dr. Mamdani and others lead, really from a population health perspective as well. So with that, and then please feel free to put questions in the chat, and we look forward to answering them. I have a few disclosures um, uh, to report, but they are not relevant to the presentation today. All right, what are our learning objectives today? So what I hope to do is really explain the foundation principles of mind-body medicine, how these approaches can support clinical care in patients with complex chronic or comorbid conditions. Identify practical strategies for integrated mind-body interventions into routine clinical workflows to enhance patient engagement, symptom management, and outcomes, and really assess the evidence base in supporting mind-body practices in diverse clinical settings, focusing on their impact on provider well-being, interdisciplinary, and healthcare utilization. So let's just take a moment to step back and to say, is this your reality? This job has cost me my health, my family, and my soul. Can I get a receipt? How many of you actually feel this way? And you can feel free to put a little thumbs up in the chat or in your among, because I know that I have felt this way. There are times even with the changing landscape of healthcare, I feel a lot like we entered this profession as a call to service. And sometimes when that expectation is not met, what happens, right, as a result of that? And I think that's one of the key pieces here that I have become keenly aware of, is that this is hard work. And it comes sometimes at some cost to some of us. And I just wanted to just call that out right from the get-go. Because in some ways, one of the things I hope to impart upon all of you is that through this work that I've been able to do in mind body medicine, it's actually allowed me to rediscover, for me personally speaking, a sense of meaning and purpose, and why the work that we do is so important in the world. So I will just give you the overview. Talk is really thinking about a little bit about definitions. I'm going to talk a little bit about neuroplasticity and mind-body medicine, because obviously you can't not talk about the brain and if we're talking about mind-body medicine, so I do want to do that. I'll talk about some research and theoretical frameworks, and really to help all of you contextualize and understand, how did mind-body medicine appear or really turn out the way it has in this current context? And why does that make sense? And where do we think it's going to go in the future directions? So how did I get into this? And this is sort of I had a patient in my residency program. When I was in internal medicine residency, came to me and they said, this is a 35-year-old individual, no significant past medical history, who presented for a routine physical exam. The family history was significant, for the father passing away from lymphoma, and mother with long-standing hypertension. And he was recently married. Worked in the IT industry, requiring significant amount of travel. Denies any tobacco, alcohol, or any illicit drug use. And due to the travel, tended to eat a lot of fast food. And I'm sure this is a case that you tend to see in your, you may see in your practice. The physical exam was an elevated body mass index of 31. Blood pressure was, borderline elevated, 135 or 90. Otherwise, no remarkable findings. You can see the labs. The HDL was 41, so borderline low. LDL 148, borderline high. Triglycerides 150, borderline high. Fasting plasma glucose 120, again borderline high. And so we had this assessment: is this hypertension, metabolic syndrome? And at that time in my residency program, the ways in which we were taught was, okay, you give them the fear factor, right? we basically try to inculcate as much fear into them and say, if you don't make changes in life, you're going to die from this and you're going to do this. And if you don't, you have diabetes, you're going to, become blind, you're going to lose a limb. This was the ways in which we were taught to motivate change. As we know now that, and then you say, okay, for every ill, there's a pill. So let's start medication, right? So let's say, oh, let's try a little bit of blood pressure medicine, or maybe we'll try a little bit of metformin here to help with the insulin resistance that's clearly present. Well, this patient was very adamant, says, I do not want medication. And so then we said, okay, well, I'll do some diet and exercise counseling. So how did we learn how to do diet and exercise counseling? Well, in those days, diet counseling was what? We just said, eat less. So I checked the box, eat less. And then exercise counseling was do more. So you check that box. I did my diet and exercise counseling. That was literally the extent to which we were taught. Now, obviously, so much has happened since then. But again, a lot of I suspect even the ways in which many of you have been trained, that's what you were taught. So then this just wanted to share with me something that he read, and he's like, and so brings this article. Doc, what do you think? And you can see the date. It's in 2003. So this is just want you to just to really. This was literally in the middle of my residency. It says the science of meditation. New age mumbo jumbo, not for millions who Americans who meditate for health and well-being. Here's how it works. And this is a Time magazine. This is what was a very popular lay person magazine that you would find in many doctors' offices in the waiting room. And it says actress Heather Graham, this is a famous actress, has been practicing transcendental meditation since 1991. So this actually raised a couple of interesting questions for me. Because one was, I did not even know that this was even a topic that we would think about in a healthcare context, like meditation in healthcare. And number two, do you have to look like this in order to practice? Like somehow there's this image of this ethereal individual. You have to have a particular body type, body image. And is this for just the select few, or is this for everyone? And those were the questions that came to my mind time and time again, and really led me down this quest of understanding this field of mind-body medicine. So, as many of you know, and this is not a surprise to any of you, non-communicable diseases are the most important global health challenge of the 21st century in terms of disease burden and mortality. And I know I'm really, to this crowd, this is a well-known fact, but I highlight this is that when we think about non-communicable diseases, what is at the core of many of those non-communicable diseases? It is really our understanding of stress and stress physiology, because that ultimately is what we're seeing is leading to some of these long-term consequences that we're seeing in conditions like diabetes and hypertension and cardiovascular disease and cancer. So again, as we think about this, I want you to really think about it from that context. So what is stress phase? So, if we just take from a very, again, initially starting from a layperson simplistic view, we have stressors in our life. I certainly deal with multiple stressors in my life every day, which includes, family relationships, disagreements, financial worries, the need to succeed, friends, decisions, new situations. That sets off this alarm. And as you've heard, many of you've heard, the fight or flight response kicks in, right? And then eventually you move, and then you're hopefully able to return back to normal physiology. If you have coping strategies, you develop coping strategies, and that also helps you return to normal. And I'll get into that in a bit later. But if you don't have coping strategies, what do we notice happens? They're negative thoughts, inappropriate responses, poor diet, stop exercising, irritability. We see sleep issues, feelings around depression, hypertension, exhaustion, and we see disease and breakdown. And again, this was most notably seen in the pandemic, and we're actually seeing the consequences post-pandemic of much of this as a result of what was happening. And we take it a little bit a deeper level when we understand this fundamentally. When we think about it from the brain level, there are things that affect the brain, developmental history. There's the genetic variations that we all have. Stress, nutrition, as you've had other talks on that, the way in which we age and longevity. And then the stress system really moves down two major axes. The hypothalamic pituitary axis, which, as you know, goes down cortisol, and we have sort of end organs on that front. And then the systemic sympathetic adrenomedullary system, right? And we have target tissues, which result, think about metabolic syndrome and insulin resistance, visceral obesity, sarcopenia. We see the changes here, as you see, triglycerides, LDL, HDL that were described in this patient. Sleep apnea, osteopenia, endothelial dysfunction, inflammation, atherosclerosis, and cardiovascular and neurovascular disease. And again, this is always this sort of it's a dynamic, right? We're living in this dynamic between what is stress in a positive way and what is stress in a negative way. And again, even at the organizational level, all of you work in organizations or work in a organization. So you might think that, okay, this is not just at the personal level, but when we spend most of our wakeful life in the workplace, then you think, what are the factors intrinsic to the job, role in the organization, relationships at work, career development issues, structure, that affects the individual. And we see stress symptoms that include in physiological, psychological, behavioral, illness, work exit. In the United States, currently, we are seeing a mass epidemic of individuals leaving medicine as a result of these. And again, you can just Google it. The number of people leaving the profession of medicine because is just not. There's no people have lost meaning, have lost joy, and the amount of burden that people are facing is just tremendous. And again, there's nothing worse than when you don't have people who show up. That leads to higher costs, dysfunction, and poor quality. So Dr. Herbert Benson, the late Dr. Herbert Benson, he would always quote this statistic that 60 to 90% of healthcare visits are related to stress. And I one time asked him, I said, well, where did you get that statistic from? And he's like, good point. Why don't you look it up? And so I did, and I found that this 1964 article is written by a famous primary care physician at Mass General Hospital here in Boston named Dr. John Stokel. And he basically cataloged, why do people come into the healthcare visit environment? And again, some 60, 90% of the visits had some component of stress related to it. Again, if you think about in your clinical practice, for those of you who practice in clinical settings, just think about most people approach the healthcare environment or the healthcare setting, not because there is a joyfulness about it. There's some stressful component to it. So then when we think about, well, what is then mind-body medicine? And as we think about it, mind-body medicine really then refers to the interactions amongst the brain, mind, body, and behavior, and on the powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly affect health. It regards as fundamental approach that respects and enhances each person's capacity for self-knowledge and self-care, and emphasizes techniques that are grounded in this approach. So I want to now take you through a little bit of tour of mind-body medicine, because there is this interesting journey that has evolved over the past century into how it has arrived in the form that it has today. And I think when you appreciate a little bit of the history, it actually helps us understand where things might go in the future. So, stress in the modern life. It says, hard-charging businessman Billy Sloan is about to learn that continued stress does inhibit one's memory. I imagine some of you may have had a moment like this every now and then, where you just like and you don't even realize what's happening. Well, in the modern life, there have been different words, and again, much of my context of this talk will really come from a United States-based context, in part just because some of the vocabulary has been sort of popularized in English. But there are words, obviously, in other languages too that I recognize also are important to acknowledge as well. But earlier word it was neurasthenia, and President Theodore Roosevelt in the early 1900s. He was president at the time. He was well known from suffering from this condition of neurasthenia, which basically meant he was chronically stressed. And so what happened as a result of that? Whenever he was president, he would, go to different states to visit the population in the state. he would hear their complaints and how things were not going right, and he couldn't deal with all of that, and so he needed a place to relieve his stress. And his preferred modality of relieving stress was to hunt. And so that actually engineered the creation of the entire national park system in the United States, because anytime he needed to go to a state, he needed to have a place to hunt. And that's where that's what the national park system sort of evolved from. Some of you have heard the term the fight or flight response, and this was coined by professor at Harvard Medical School, Walter Cannon. Described it as an increase of blood sugar, a secretion of adrenaline, which we know is really norepinephrine, epinephrine, dilation of pupils, and piloerection. Now, the question emerges from this is this evolutionarily advantageous or disadvantageous? Is stress bad inherently? And it turns out, no, it's not, because we know that if a bear is in front of you, or if the lion is in front of you, you don't want to sit and meditate. That is not going to help your survival, right? So we need to be able to mount a stress response. It's really this mounting of resources. But if you're in the car and you're driving and someone cuts you off as you're driving, you notice that that response emerges, right? And if that response is happening over and over and over again, that's where we begin to see the emergence of stress-related illness. The late Richard Lazarus and Susan Folkman described the psychology of stress. And basically, this is a process in which environmental demands tax or exceed the adaptive capacity of an organism. It may result in psychological and or biological changes that may place persons at risk for disease. They're stressors, right? So these are the environmental experiences that we have. And then there's the appraisal. These are the subjective evaluations of the stressfulness of situations. So we know that different people can have different appraisals of the same stressor, right? And that's based on a whole host of factors. But again, then from that emerges our stress response. These are the affective, behavioral, or biological responses to stressors or appraisals. They're the laboratory examinations of stress too. And one of the things that we began to think about is that what happens over the course of a lifetime. So some of you may describe yourself as type A personality. You may have heard that term. And what does type A mean, essentially? Well, these studies were looking at different personalities and the link to coronary artery disease. And at that time, when these studies were conducted, people who were of the constitution of type A were thought to be more at higher risk for having a heart attack. Well, it turns out that those studies were a bit flawed, and so those links aren't as strong as one would think, because of certain confounders were not accounted for. And yet, the language has still remained in our vocabulary. We actually have forgotten what type B and C personalities are. Like, we don't even know what those are in those studies, but we still remember type A. There's stress and a link to the immune system as well. And again, what we know, this is a beautiful study done in the New England Journal of Medicine over 30 years ago, and basically took young, healthy volunteers. They were students. They inoculated them with the virus of the common cold and put them in a hotel room. And they wanted to see who developed this cold and for how long. And what is very clear, and then they asked prior to the inoculation, how stressed are you? And this was a standardized scale. You can see very clearly here from this study that the more stressed somebody was, the higher the risk of infection. This is a randomized study. It's one of the most, it's a very beautifully designed study. Well, here's the interesting part of the study. So this was really a game changer in the field, because it showed it really was part of this field of psychoneural immunology, that actually how stressed we are can actually affect our immune response. Well, it turns out if you look at, they actually looked at different viruses. There's the rhinovirus, that's RV. RSV is respiratory syncytial virus. And you can see that then they started looking at the top quartile of stress versus the bottom quartile, high versus low. You can see all the way to the right, there's this one that's clearly different than the others, right? It's like very susceptible to high versus low, and they have very high incidence of cold. And you see it's bottom, there's CV. Well, what's CV? That's actually coronavirus. Yes, it is in the same family as what was responsible for the pandemic. but related, but slightly different. But you can see that in this, that it was clearly affected by the stress response. And this is one of the things I feel from a public health, this is one of the missed messages. We missed the opportunity to message the general public about the role of stress in as a risk mitigation strategy for the COVID-19 pandemic, right? Because we talked about, hand washing, very important, mask wearing, very important, immunization, very important. But did we ever talk about stress reduction? And we didn't. And again, this is Dr. Cohen actually talks about this a little bit late, 30 years later, reflecting upon this day. A bit more modest in what he can say, but I challenge you to think like, we had an opportunity here. So how do we now integrate it? The stress response, again, this is the late Bruce McEwen. He basically then put this all together, and he really described this around the concept of allostatic load. Stress response, the cumulative effects of stress over the course of lifetime. And we know that there are multiple things that affected our sense of perceived stress. We have environmental stressors, right? Where we work, our home environment, neighborhood, we see that time and time again. Major life events like divorce, birth of a child, death of a parent, history of trauma. We're recognizing more and more those consequences last, what even happens in early childhood lasts well into adulthood. And actually crosses generations as we're learning more and more. There are individual differences, our genes, the way we were raised, our experiences, that affects our sense of perceived stress. There are behavioral responses that include the ways in which our diet, smoking, drinking, exercise. We know that alcohol consumption during the pandemic increased 15% during this. And then allostasis, some of you know the term homeostasis, which is this dynamic equilibrium at one point in time. Allostasis is the ability to adapt. So when there is a stressor in front of you, you're able to mount the stress response. But when the stressor is no longer there, you're able to return back to normal physiology. When you have increased allostatic load, your ability to mount, that ability to shift between the stress response and being back in the sort of baseline physiology we lose that, or it diminishes. So neuroplasticity then, so what happens to the brain then? Because we have to think like, why is this happening? Well, let's just define neuroplasticity for a moment. It's the brain. It's a process that involves adaptive structural and functional changes to the brain. And this is the ability of the nervous system to change its activity in response to intrinsic or extrinsic stimuli by reorganizing its structure, functions, or connections. This is about a self-protective mechanism. Across the lifetime, we know that the brains of children and adolescents are exceptionally plastic, allowing for significant changes and adaptations in response to learning experiences. This developmental plasticity gradually decreases with age, but persists throughout life, it turns out. There are adaptive changes. It's not actually limited to specific age ranges. Even in adulthood, the brain remains adaptable, and ongoing learning, mental stimulation, and lifestyle factors can continue to shape its structure. There is a reason why all of you are here today, right? This is, I hope, is a little bit of mental stimulation. And actually, this allows for us to stay a sense of youthfulness when we're in this space of learning and creativity. Well, we know that the relationship between mind-body practices, different neuroscientists have described what are the things that have been affected. And particularly the prefrontal cortex, many regions are implicated here. The anterior cingulate cortex, which is sort of the operating system by which prefrontal cortex operates through to get to the rest of the body. And the amygdala, as some of you know, was the emotional center, and that sort of primitive emotion, like where the instinctual response lives in terms of our affective response. So mind-body practices and neuroplasticity, we know that the anterior cingulate cortex is the region associated with attention, in which activity and structural changes in response to mind-body practices are most consistently reported. We know that mind-body practices, I'm going to show you a little bit here in a moment, improve emotional regulation and reduce stress. Frontal limbic networks involving these processes show various patterns of engagement, and they have the potential to affect self-referential processing and improving present moment networks. The default mode network, which is sort of our baseline, how we operate without knowing, essentially, is actually can be altered. So what are some of the structural changes that we see and some of the functional changes that we see in mind-body practices? Well, this is a famous study done by Sarah Lazar in 2005, looking at advanced meditators. And they found that advanced by more than having 10,000 hours of practice, they areas of their prefrontal cortex were thicker than age and gender match controls. This was groundbreaking study. Now, why was this? It could have been, most people think it's because of increased synaptic connections were created. But the idea is that the challenge is conventional wisdom that brains actually shrink in size as we get older. We know that the structure includes areas that affect cognition, executive function, emotion regulation, neurotransmitter release. So again, this is one of the things that we're seeing about these mind-body practices that really, truly have changed the way of the brain. So this is one important dimension of mind-body medicine, is really that there is a fundamental physiologic and neuroscientific basis that we actually see. And again, I'm just giving you a snippet of some of the highlights of the literature. There are studies that come out daily now on this topic. What is another important aspect of mind body? It's really around power of suggestion. This is a study that looked at telling people, basically, we're going to give you a medicine that helps mitigate your response to pain. There's where they were randomized was that one group was told that you're getting the regular price medication, and the other one is you're going to get the low price or the generic one. And this study, you can see very clearly, as shock intensity increases, the differences between the low price and the regular price were quite remarkable. With that being said, what people didn't know is that everything was placebo. There was nothing. It was simply the power of suggestion. We can see that affects. And mind-body practices actually rely upon these powers of suggestion. Why is that? Well, it turns out because there's a lot of learning that we do through mind. There's mental activity and neural changes. These learning or experiencing new triggers changes in the brain. And these are actually challenging the neural connections. There's cognitive processes like problem solving, critical thinking, memory retrieval that affect, and these actually lead to it. And then there's the emotions, and these lead to the changes in brain structure and function. We actually know that positive emotions contribute to releasing neurotransmitters like dopamine, promoting neural growth and connectivity. And chronic stress or negative emotions have detrimental effects. And we can see that even in that simple study of like how we suggest can actually start shifting the way in which we think about things. The neurotransmitters, such as serotonin and dopamine, they play a role in synaptic plasticity, and these actually can influence. And what we know here is that it is very dynamic. So it's not just that one point of the brain is affected at one point in time. As we actually go through a mind-body practice, we are dynamically affecting different parts of the brain. From the mind wandering place where you say, oh, I notice my mind is wandering. Then you build a focus, you distraction awareness, you reorient the awareness, and you sustain the focus. And that is the circle in which the mind-body practices operate. There's a mind wandering, a distraction awareness, a reorientation awareness, and the sustaining of the focus. And what do we know out of all of this is that there's improved health, mental health and well-being, enhanced cognitive function, resilience, and potential impacts on physical health. We actually can see this levels at outcomes, and I'm going to highlight a few of these studies. Changes in gene expression, I already mentioned altered neurotransmitter activity, synaptic efficiency, generation of neurons, changes in the cortical maps, and then the ways in which these interactions between different parts of the brains are affected. There's a dimension of mind-body medicine that I would also want to highlight that is about the power of positive thinking. This is a wonderful study done by one of my colleagues and mentors, Ted Kapchuk. And he really studied the effect of like placebo. What does this really mean? And he said this joke, he said, I want you to take this placebo 2 times a day for 10 days. If your condition doesn't improve, I'll give you a stronger one. And this is a study of irritable bowel syndrome. And basically, he looked at 3 different groups randomized. One group was simply told, you're going to be in the study. You're going to have to wait 6 weeks, but you'll be in the study. And that was the wait list group. Then there was the limited. These were actually individuals that were receiving acupuncture, and they had a scripted encounter. my name is so-and-so, I'm going to be doing acupuncture, this is going to take this many minutes, I'll be back after it's done. And then there was the augmented encounter, which was like the way in which we communicate, the human connection. You tell me how you're feeling, just these some very simple empathetic questions to the individual's experience. You can see very clearly that in this standardized scale for irritable bowel syndrome, which has been used to grant FDA approval for medications, each group had improvement that was actually clinically important. What's also interesting is that the augmented had an effect that was far greater than, and this effect was so great that if this study had been shown to the FDA, they said, "Oh, which drug is this?" It is, it's sufficient for approval for in terms of a pharmaceutical agent. But what you don't know about the study is that no one received anything here. Even the acupuncture, they had really there was no piercing of the skin. It's simply this idea, they actually just just placed the needle on top of the skin without piercing the skin and taped it, and the individuals believed that they were receiving acupuncture, but they truly weren't. And as a result of that, patients actually, that was blinded so perfectly, it was 50-50% that they thought they were getting real acupuncture versus not. So it was a perfectly blinded study too. So this idea, that there is the idea that we have a sense of what it means to feel well, and the belief in the therapy, and that is actually the interactions between, the study really highlights that the interactions between individuals, the relational aspect, is also a key piece of mind-body medicine. It affects the ways in which we think about things. There's another part of this that I want to highlight, the healing network. Mind-body medicine oftentimes happens in a group-based setting, many of the more latest interventions. And this is a story of Roseto, Pennsylvania. It's a small town in Pennsylvania. And what was about this town was that people noticed in the 1950s that people in this town were living longer than the adjacent towns. And they're like, what's about this town in 1950? They were living 10 years longer. It was an Italian immigrant community. And they thought, oh, okay, it must be that Mediterranean diet. Well, at this point, by the time they were all on what we call the SAD diet, or the standard American diet. The adjacent towns were German immigrants. Then they thought, well, is it the smoking rates? And it turns out that wasn't it. And so they looked at all different factors. And it turns out the one factor that explained the life expectancy difference was that when somebody got ill, people came together in group to help lift that person up. Or somebody fell down, and that sort of setting. So what's even more fascinating about this story is that 50 years later, they looked at the same town, and all the life expectancy has normalized, in part because people have left the community. But the idea that doing work in group settings, in a sense of that I am not alone. And we see this post-pandemic, what was the greatest impact, unintended consequence of the pandemic was the sense of loneliness that we're now dealing with today. Finally, I just want to highlight that one of the dimensions is this sort of notion of going to the East. And I think in the United States and sort of popular culture, they kind of made this moving towards the East as this interesting phenomenon that happened in the 60s and 70s. The music played a big role, like the Beatles. There were these Asian spiritual practices. Thich Nhat Hanh, who just recently passed away, Paramahansa Yogananda, Krishnamurti. There were these non-Asian mystical practices, centering prayer in the monastic traditions in Christianity, Kabbalah, Sufism. Dr. Benson, he really was approached by this individual, the Maharishi, Mahesh Yogi, who was the founder of this movement called Transcendental Meditation. And I think, which was one of these, they had originally influenced the Beatles. Those of you, if you listen to the Beatles music, there was a whole South Asian influence in one of their albums, and really came out of their interactions with this individual. But he described that there's this through mind-body practice and meditation, there's another state of consciousness, and Dr. Benson was really keen on studying this. He was a cardiologist looking at hypertension, and their followers approached him and said, "Study us because we can show you that we can actually make an impact on blood pressure." And his whole career since those interactions was really based on this. He published this book, The Relaxation Response, that described this physiology. And the conditions by which it's evoked is a repetition of a word, sound, prayer, thought, phrase, or muscular activity, and a passive return to the repetition with other thoughts and truth. It's breaking the train of everyday thought. And it turns out the benefits are seen as little as 15 minutes daily. You can see the interactions with the Dalai Lama, and that sort of is evolved, that this is a phenomenon that is present in all of the world's traditions. It is not unique to one world tradition. Just as we have a universal stress response, we have developed ways across all cultures to counteract the negative effects of the stress response. And that he coined that term as the relaxation response. This became much more popular by other individuals like Jon Kabat-Zinn, as you can see here. And there's a famous public series by a journalist called Bill Moyers, who really made this popular in the United States, called Healing in the Mind. And he developed this program called Mindfulness-Based Stress Reduction, MBSR, which origins are based in Buddhist meditation practices, but it's characterized by a psychological state of intentional, non-judgmental, present moment awareness. So the present reality is this: I'm learning how to relax, doctor. I want to relax better and faster. I want to be on the cutting edge of relaxation. And what we know, as I alluded to earlier, is that meditation and mind-body practice actually changes gene expression. These are studies done by our group that found that there are changes in the genes might be fixed, but how these genes are turned on and off actually changes. There are decreases in inflammatory pathways, improvements in insulin utilization, increased ATP synthase and mitochondrial energy. We actually know that blood pressure responses change, and those that are responders truly are having impacts that are equivalent to medication. And this is one of the seminal studies that we did in our group that are looking at the transcriptome changes. So what we know that when we elicit the relaxation response, it impacts apoptosis, stress response, and inflammation. And this, again, is critical. We also know that there's changes in here. This is looking at a cardiac rehabilitation program. We run one which has a mind-body component. And what do we find at 3 years? When people go through, this was comparing to people who went through a traditional cardiac rehab, just covered exercise and nutrition, versus those that did not go to cardiac. And these were individuals with moderate to severe coronary artery disease. And they find that at 3 years, you can see the mortality difference is quite significant, 10% in the control arms versus 6% in ours. But it also reduces cost, because it turns out that when people at 3 years, we see that differences in cost. There's a cost savings of roughly in the range of, you can see here, about $2,500 per patient per year. There's a reduction in billable encounters, and it turns out that this savings can be as high as $25,000. And other interventions, we also know that incorporating mind-body practices is actually, again, affects our response. This is a beautiful study that looked at meditation in response to given the flu vaccine. And when we see that people who practice meditation as they're receiving the flu vaccine, their titer response doubles. Again, another possible area where we could have had a significant impact in the pandemic is, as people were getting their vaccines, can we actually optimize their vaccine response? And that's one of the areas that has been particularly interesting to me as well. And why do we know? We know that now in the immune system, there are changes at NF-kappa B, C-reactive protein, there's cell-mediated immunity activities, and obviously even the ways in which we age. I'm just showing some recent studies that have been published in major journals. We can see that this is a non-inferiority study found that is equivalent to escitalopram in the treatment of anxiety disorders. And this is a mindfulness-based stress reduction program. This is a meditation training in older adults, and found that there are significant changes in particular areas in the anterior cingulate cortex in individuals who went through a meditation training program. And this in terms of perfusion. And then finally, we see that cognitive changes, there are also important cognitive executive function changes that at 6 months are significant as well. So what are we talking about here? When we put this all together, is really we're trying to create a whole new equation in the ways in which we think about We're looking at allostatic load, which I spoke to earlier. We're looking at social support, resiliency factors, and what is the selective vulnerability, the propensity to illness. If we flip this equation, it's the propensity to wellness. We know that in the United States, and this is, again, the trend worldwide, is that use of yoga and meditation has dramatically increased over the past decade, even increasing in children as well. And I think this is an opportunity for us to really set a new path forward from a societal perspective, from a public health, is that how do we think of not just, we've been talking about it from a secondary prevention, there's primary prevention, and I would even argue primordial prevention, where how do we even allow this to even allow change to happen before even children are born? And those are some of the newer work that people are thinking about. So mind-body medicine, to summarize, is really a healthcare provider-led rituals. It's the healing power of an examined life. These are patient-initiated practices and self-empowerment. There's a scientific examination of the mind-body connection, social network. There are exotic examination of medical and moral redemption, and actually fundamentally allows a blurring of boundaries between religious and secular worlds that is, I think, very important to address in modern healthcare context. People are looking for providers to actually address this space, and mind-body medicine, I found, allows us to, both as providers and as patients, to safely examine the space in a way that is health promoting. And that's now we've developed a program at the Benson Henry Institute called the SMART program, which stands for Stress Management and Resiliency Training. This is an evidence-based program, and resiliency really can be built through a three-tiered process, which is ongoing practices of techniques which elicit the relaxation response, building awareness of stress and its negative effects, and promoting social connected and healthy lifestyle behaviors. This is an 8-week multimodal program that incorporates elements of modern psychotherapeutic evidence base with wisdom traditions through mind-body practices. And again, you can see this is the pillar of the SMART program. We've been able to do this and we found that these approaches actually reduce the frequency of medical symptoms, decreases severity of psychiatric symptoms, and increases health promoting lifestyles. We've actually done work in healthcare professionals and showed that it improves global perceived stress, mental, physical health, and job satisfaction as well. So how do we actually build a practice? Well, one, as a healthcare professional, what it is really allowing to become aware. This is a beautiful article by Ron Epstein, and this is the idea of building mindful awareness. It's becoming aware of one's own mental processes, listening more attentively, becoming flexible, and recognizing bias and judgments, and thereby acting with principles and compassion. It's the ability to observe the observed while observing the observer in the consulting room. And this requires mentorship and guidance. And so when we think about the mindful practice, it's the active observation of oneself, the patient, the problem. There's critical curiosity. It's the courage to see the world as it is rather than have one would have it be. Willingness to examine and set aside categories and prejudice. Having a beginner's mind, the humility to tolerate awareness of one's areas of incompetence, and compassion based on insight, and having full presence. And what we know is that this actually associated with a greater emotional awareness, greater communication of psychosocial issues, care that is more patient-centered, increased patient satisfaction, and improved outcomes. As I mentioned, this is a tradition in all the world's traditions. If you look throughout, the idea of conscious focusing on one's awareness in observing thoughts and feelings without judgment is described in all of the world's traditions. And so, as I mentioned, there are two basic elements. So what I'd like to do is just engage for 1 minute in a practice with all of you. And just so what I'd invite you to do is just allowing yourself to feel comfortable in your chair, wherever you may be. And just allowing your eyes to gently close. And if you like, just having a soft gaze towards a spot on the floor or table in front of you. Letting your hands rest in your lap or on your knees, and taking 1 or 2 deep breaths, just to notice where your own breath is. And bring your own awareness to that triangular region that is surrounded by the bridge of your nose, the edges of your nostrils, and your upper lip. And simply noticing your own breath as it passes through that region. Perhaps it may be fast, might be slow, it may be deep, or it might be shallow. Whatever you notice, allowing that to be as it is. Not trying to change it in any way, but noticing it. And if you notice your mind wandering, just acknowledging that and gently but firmly bring your own awareness back to your own breath. And as you feel comfortable doing so, you close your eyes, allowing your eyes to gently open. So, what did you notice? You just notice. Can you imagine if prior to every medical visit, you just take a moment for yourself and how that might change the ways in which you interact or are present for the individual or community or hospital system in front of you? One of the things we do in these programs is really go through a series of experiential activities. So elicitation, relaxation response, building awareness, this example and exercise that we do called energy battery, really developing firsthand what is the awareness. It's about practicing giving and receiving practices. These are skilled practices that are developed. It's understanding our social supports and in the ways in which we give and receive supports in different dimensions. And then it's also about creating a space of appreciation, focusing on what, we often focus on what is bad or wrong, but can you imagine if you start off every day purposefully bringing attention to what we appreciate? Turns out that is one of the most powerful antidotes to the micro stressors that we deal with every day. So the idea is really to understand how do we put our own oxygen mask first, and this is a lot of the work I've done in our hospital system, is teaching my colleagues, that self-care and resiliency building is not selfish. It's essential for our own well-being and allows us to better care for others. And the time investment more than pays for itself. So there are many tools, mind, body, lifestyle, cognitive. This involves increasing awareness and choice, and this is a dynamic process and a learned skill. And ultimately, it boils down to this question of what allows you to feel whole. So in the last couple minutes, I just wanted to give you a sense of what has allowed me to feel whole over the past, in my professional life. And part of it is this understanding of pillars of finding meaning. It turns out that happiness is overrated, but where do I find sense of balance, right? I really want to feel a sense of balance. And the idea is that when we have a sense of belonging, Brene Brown says that those who have the strong sense of love and belonging have the courage to be imperfect. We are in this perfectionist mindset all the time. How do we actually create a space of belonging that it's okay to also be imperfect? It's about having a sense of purpose. This is this concept of ikigai in Japanese context. When you love the work you do, you're great at it, you're paid for it, and the world needs it. And we have all four of those things. That's the sweet spot. So for me in the pandemic, it was about remembering my purpose. I actually was deployed to a COVID makeshift hospital that dealt with patients with COVID. And I was like, wow, I feel even amidst the uncertainty, the fear, when I had my sense of purpose, I was able to actually move out of the sense of stress response into a sense of meaning and purpose. My family has been an important part. I've gone through different life struggles over the past decade in my life, 2 decades having loss, whether it's loss of children, loss of relationships, loss of parents, and yet finding the space of support. Family has been an important dimension to me. These are my college and high school friends. Returning back, how do I ask for support? I learned to ask for support during these tough moments. But also, it's important to have a sense of my mentor. My mentor, this is Dr. Greg Frashoni, he's one of my mentors, and just having that anchor in your life has been a critical part of a sense of well-being for me. But I also love being around learners and being able to be amongst all of you. It gives me a sense of, wow, has a tremendous sense of meaning and support. This is I'm the faculty advisor for the South Asian medical students at Harvard Medical School. And being there, it's been a great space of support. I also have opportunity. It gives me a sense of community and really a sense of youthfulness as I've gotten. And then transcendence, like when this work is greater than the self. I think when we make it greater than self, that to me is a big piece. And for me, over the past decade, it has allowed me to actually, this work has allowed me to begin to re-explore dimensions of faith where I find meaning and purpose. And as a physician, it has allowed me to actually expand the vocabulary in which and the ways in which I can connect with my patient. So this is all about, hopefully modeling, being able to model and inspire this type of work. And for me, it's about creating space for courageous vulnerability. So my last slide, really, we have many hurdles left to clear here, funding the science that needs to be done, proving clinical efficacy, biological mechanisms, cost effectiveness, bias, creating culture change. But I feel we've come quite a ways in broadening acceptability and accessibility in the community. And can you imagine at Harvard Medical School, at Mass General Hospital at Brigham, this has become part and parcel of the culture. So there's a summary, take-home points. There is a neurohormonal, epigenetic, and physiologic basis. It can be safely delivered, and there's a body of evidence that suggests this is use of part of comprehensive treatment. William James said the greatest discovery in my generation is that human beings, by changing the inner attitudes of their minds, can change the outer aspects of their lives. It is too bad that more people will not accept this tremendous discovery and begin living with it. Thank you, everybody, and thank you to the team here for inviting me, and we welcome any questions.
Great, Dr. Mehta. That was an amazing discussion. I think a very nice and yet very comprehensive discussion on science of mind-body medicine, its application. You began with a case that you encountered in your practice and how that led you to start incorporating that in your medicine. We all have stories, so a wonderful story, and we appreciate your remarks and your discussion. So thank you so much. I want to begin by saying that many people are appreciative. I'm looking at the chat and the Q&A of the information that you've shared, and as I said, extremely helpful. But in that discussion, there are questions and comments, of course, right? So may I present to you maybe 3 or 4 questions? I think we are doing okay on time.
I'm flexible, so I can stay.
Okay, okay.
Yeah.
You shared a very important slide on 60 to 90% of visits being related to stress, I guess, directly or indirectly, is the way I would categorize. And I'm thinking of what we call as psychosomatic conditions. And you're probably familiar with that, as I am. And I'm thinking of TMJ, irritable bowel syndrome, tension headaches, and then the list goes on. There are about 8 or 9. And I am thinking of a write-up that appeared in the Lancet about 20 years ago. And they call them specialty-driven syndromes. You may recall that. We are living in a medical world where we have a tendency, and I'm talking about healthcare practitioners, to basically medicalize even simple difficulties in life. And oftentimes they translate into these diagnoses.
Yeah.
I'm becoming familiar with overdiagnosis and so on and so forth.
Yeah.
What is it that practitioners and our healthcare providers do to help our patients? I mean, before jumping to pills and so on
Right.
and so forth. I
Yeah.
think mind-body medicine would be one approach. But can you just talk to us
Yeah.
about that?
Well, I think you raise a very important point that we often, because especially in these especially at the institutions that you and I represent, people come there for, I need to have the specialty care and diagnosis, and the mindset, by and large, across the world, again, is that there is a pill for every ill. So they're trying to find that magic pill. What after today, I'm going to have a whole day of clinic after this presentation, and in my practice, majority of what I do is, and again, this is consistent with the principles of lifestyle medicine, is really empowering patients that you actually can own. I'm not saying all of this is on you, but if we're saying that the first 50%, if we can bring this down, that's relief. That is relief that you actually have true, and that sense of agency people are not taught, I find, in clinical practice. And so much of the work I do, and through these mind-body practices, I realize, wow, we actually have a lot more power than we give ourselves credit for. Now, I'm not anti-medicine. I'm going to be very clear. There is a role for medication, but we don't approach this in a synergistic way. We often say, okay, let's do the medication first, and then we'll think about the lifestyle stuff later. But I think we need to do these things in tandem. And again, tailoring the empowering patients is the big, and I found that this approach allows me to empower the patient. Like you get to actually own this, and I will be a guide with you along the way. But at the end of the day, I want you to be in the driver's seat of your health.
Yeah. I think that's a great response. I think empowering people to not only help them make informed choices about their health, but also to empower themselves and their mind, so to speak.
Yeah.
And you talk, about resilience and so on and so forth.
Yeah,
So,
I'll just can I make a quick point that common conditions we see in the clinic, chronic back pain, headache, sleep issues, all of these are stress related. If you look at the ACP guidelines, American College of Physicians guidelines for chronic back pain, in the first line recommendations is
yeah,
stress reduction.
yeah,
So it is there. The
absolutely.
evidence is very clear on these
Yeah,
fronts.
yeah, yeah. There's another question on, how does one cope with what is this member is asking is permanent stress, coping with permanent stress. I mean, somebody who's living with stress day in and day out.
Yeah.
Uh, how does one cope with something like that?
No, that's it's tough. I mean, we're in a very difficult world, and again, I feel more for our children, even more so now than because there's no disconnection. Like when you think about the media constantly on, like 24/7, you're bombarded with stressfulness. Uh, so this is where these mind-body strategies create. Like if you notice I hope those of you engaged in the practice, just taking that 1 minute allowed you to just disconnect. You could probably notice a little bit of ease or a little bit of, oh, whew, I can breathe. There's space created. So again, I think a lot of this is around we have to create these micro moments. Sometimes people think, oh, I need to do the 1 hour meditation practice. We actually don't encourage that in the beginning. That's impossible for most of it. But you can start with the 30-second one like we just did right now, or 1 minute, and you can do that multiple times a day. And those allow this sense that actually it's not permanent stress. You create a space of impermanence because you're actually intervening at multiple time points.
Yeah. So there's another question on changing your mindset,
Mm.
i.e., the way you think about things in life.
Yeah, yeah,
And
yeah,
if you begin to think in somewhat different way, you
yeah,
probably feel better, if you
yeah,
will.
yeah,
How does certainly practitioners can help with that, I would
yeah.
imagine. Uh,
Oh, yeah, yeah. I think this is, and I alluded to a few of the, so we, through the work that we've developed at Benson Henry Institute, the SMART program, the stress management, those three pillars. One of the pillars really is around adaptive lifestyle strategies, which includes approaches to like appreciation. So appreciation, when you do it, again, these are not big moments. It's multiple little moments. So if you have a begin daily practice of appreciation, um, already you're changing your mindset. Because it turns out the brain knows no difference between when you experience the moment and when you relive the moment. It's the same, and that reinforces that positive feedback loop in the neurocircuitry. So I would say that is, these are the tools. And again, I think all of these tools have a evidence base to it. What we've been able to successfully do through our work is put it into a composite and manualized approach.
Thank you. Uh, one participant says, I have an autistic child,
Hmm.
and wants your comments on, neuroplasticity with regard to
Yeah. Yeah.
autistic conditions, and
Yeah.
if meditation can help,
Yeah.
uh,
Yeah.
such a person. Yeah.
Yeah, and I'm not I'm in internal medicine, so my actual expertise on this is limited. With that said, what we do, we have actually done studies on caregivers of children with autism because it turns out the stress response in caregivers is actually quite high. So where I would encourage the individual to start is like, how are you taking care of yourself? Because because again, you know that your child has increased needs, and you know your child best. Actually, I wouldn't even say I would. You know how to best, but you have to replenish your cup in order to best know what is needed for your child. So I'm not saying we are. There are some studies looking into how, again, it's a spectrum. There are different types of autism, and so it's not going to be one formula fits all. But for caregivers, and
Yeah.
parents of children with autism, that's a key demographic that we're looking at.
Yeah. Okay. So and I know we've crossed the limit, but this is just one last question.
Sure. Yeah.
We as practitioners are told, behavior modification, and that
Mhm.
certainly applies to lifestyle
Yeah.
health more than anything else.
Yeah.
And you made reference to that.
Mhm.
And then we find, comments such as techniques that can be helpful,
Mhm.
um, coaching, counseling,
Mhm.
cognitive behavior therapy, motivational
Yeah.
interviewing.
Yes.
Can you comment on those? I mean, what are the differences and where, as a health practitioner, should I go to learn more about these?
Yeah, I
Please.
mean, again, I don't think it's one versus the other. Again, and so our trajectory, if you looked at the way I presented this, it's a sort of a historical talk. We began to recognize these different themes that came through, and the ultimate end product has been a composite of all of like we've been able to take the nuggets of CBT, of behavior modification, of motivational interview, and in our case, in the work we've done over the decades, has really been to take these nuggets and put them together in a synergistic way. So I don't think it's going to ever be one versus. I think we have to give people a toolkit ultimately. And if we want people to be in the driver's seat of the health, we want to empower them to know how to use the different tools,
Yeah.
and in that way. And so it's sort of our goal in our institute. And certainly you're welcome to those who, if you have interest, just come to our institute website and you'll learn more about some of the work we're doing. But yes, that's how we've approached it. Is that there is no one perfect way. The idea is, can you give people a toolkit that they can feel empowered to, yes, I know which tool to use for what is in front of me.
Well, that's wonderful, and thank you so much. I remember my days dealing with chronic illnesses, and the one thing that I realized that if you're a good listener,
Hmm.
and if you listen to patients who are in pain and suffering, they're
Yeah.
telling you, they're giving the diagnosis and perhaps even telling you how to help them. And
Yes,
I think there's
absolutely.
merit to that statement. I think
Totally.
listening,
Totally.
just listening alone, right, Dr. Mehta?
Oh my gosh, you
Absolutely.
cannot. I could not have said any better.
Yeah.
I fully, and I obviously, I look to someone like you having so much wisdom in this arena.
Yeah.
Absolutely, there's no. I feel lucky. I'll just find it's truly blessed to be in this field. Never imagined like this would be my life trajectory in this line,
Yeah.
but I'm truly grateful and get to interact with amazing individuals like you and others. So yeah, thank you again for having me in this
Well, we appreciate it. You and I have common goals and
yeah,
objectives, and
yeah.
we just to say we will stay in touch
Yes.
and we'll continue to collaborate. And I'm grateful to you for your contribution to our program at Cornell in Qatar. So
Thank you.
thank you so
Okay.
much, and I want to
Thank
thank the
you.
audience.
Yes.
Um, Dr. Mehta and I thank the audience, right,
Yes.
for asking
Yes. Thank
questions
you.
and
Yes.
making comments.
Absolutely. Yes.
So thank you, everyone. Thank you, Dr. Mehta, and thank you, Raji and team, and thanks to Alan, IT people. Wonderful, amazing, and we appreciate it.